Global health collaboration can sound abstract, like something discussed in conference rooms and policy papers, but for us, it became real in Agbogbloshie. Standing at the e-waste dump site, sitting with women cooking beside burning wires, watching children breathe air thick with smoke and metal dust, we kept asking ourselves, what does health mean when pollution is part of daily life? And what happens if nothing changes?
So right here behind me, you can see one of the e-waste burning sites. Our project was birthed from a need to understand how toxic metal exposure affects the metabolic health of women and children living near e-waste recycling sites, and how nutrition could become both a pathway to better health and a sustainable livelihood model that empowers women. We worked in close partnership with colleagues at the University of Michigan and our local community partners to design and implement this project, which was funded by the Center for Global Health Equity at the University of Michigan.
We are right in the middle of the Agbogbloshie community. Right behind me, we have one of the dismantling centers of the e-waste. The program was special because it was all-inclusive. The institutions, the local community leaders, and women and children. They did not only participate, but they helped us shape the questions we asked, the nutrition interventions, and the skills training. Looking ahead, we see strong potential to expand this work to reach more families living near e-waste sites. The project didn't just deliver, but it builds relationships and a foundation for lasting collaborations.
What happens here in Agbogbloshie reflects a global challenge: how environmental pollution, nutrition, and poverty intersect to shape health. By measuring toxic metal exposure, metabolic health and nutrition indicators, and testing nutrition-based solutions rooted in local food systems, this project moves beyond simply documenting harm to testing solutions that protect health and create opportunities for women.
I think I'm also, learn more about the nutrition issue of the community. You know, sometimes our children always dependent on this Indomie, fried rice, and so on. But we have this project tell us that yes, in fact, it have effect from our children, especially my children all the time. Their food is Indomie, fried rice, and I've been saying the same. So when this project come and I get to know that yes, it affects a lot of, children nutrition. So in fact, this project is the best project so far.
I think the project that has come to this particular community, which is called Fadama or Agbogbloshie, people call it, has helped us a lot. For instance, I particularly didn't know that people living around the burning site has some effect in them. But as a result of this project, I have been able to also know that, yes, of course, people living around that area has a problem. And also, even after taking care of them, they also educated them as to how they will eat to increase their nutritional diet in order to help them to live a healthy living.
I was happy to be part of the project. We were taught hand hygiene before and after cooking, also healthy eating to protect us and our children from falling sick. I also learned skills in pastry making to help me provide healthy foods for the family and to take care of my children's education. I would plead if we could be supported to have more training and a startup package for the business. That's it. Thank you. I was excited to be part of this project, and it was indeed a great help to us. We were taught to use locally available fruits that protect us from illness and also wash our foods and hands properly before and after cooking and eating. I really enjoyed the skills training, but it was so short. So my appeal is for us to get more training and support to start our business. Tipaya.
What excites us most about this partnership is the chance to transform research and community voices into action that protects the health and future of women and children living near the Agbogbloshie e-waste site.
We gratefully acknowledge the support of our funding partners, the Center for Global Health Equity, the University of Michigan, and the University of Ghana, as well as other collaborators for making this project possible.